Welcome to the meeting to discuss the new mental health clinic in Jordan, Minnesota. I want to welcome the Minnesota State Department of Human Services. You are the private practice association that runs the Minnesota Mental Health Clinics. I want to welcome the newly hired manager of the Jordan City Mental Health Clinic. You are the one that will put into practice the efforts we are expending tonight. I want to welcome the marketing team for this project. You will catalyze more understanding in the community and help the vision of this project. All of you are crucial to the implementation and success of this project. I acknowledge your interest and your help in this endeavor. Each of you has a packet in front of you with some information about this project. Please note any questions you have during this presentation. We will have time at the conclusion for any questions. I recognize your time today and the collaborative effort that this project will necessitate. My name is Diane Hill. I'm a registered nurse and team lead for this project. Our conference today revolves around the new mental health clinic to be built in Jordan, Minnesota. This will be a broad analysis meeting with windshield survey findings, environmental analysis, social determinants, policy and financial support, mental health clinic proposal, intended outcomes, funding, budget, and plan outline with a discussion on the future of this clinic. This is very exciting and thrilling to participate with all of you. Today, we will begin. Those of you in this room are the primary stakeholders in this project. Why the change? As you all know, Jordan had a teen suicide last year. This has highlighted the need for more mental health solutions. Also, Jordan's population comprises 50% under the age of 30 and 70% under the age of 40. Severe mental health conditions typically onset by the age of 25. Nearly 1 in 5 adults in the U.S. have experienced a form of mental health condition, and 1 in 25 live with a severe or persistent mental illness, such as schizophrenia or bipolar disorder. With the population of Jordan being around 7,000, statistically, 280 residents of Jordan are dealing with some sort of mental health condition. Those with mental health issues often suffer silently. Along with the clinic, this community needs more education and support for those that struggle with mental health. We will discuss concerns and are open to continued collaboration to make this work. With a project like this, there are always risks. With the assistance of the Minnesota State Department of Human Services, those risks are mitigated because they already run multiple clinics in the area. Addressing the systemic barriers to expanding care in specialty psychiatric clinics that can improve the quality of care remains a high priority for the mental health policymakers. A windshield survey has been completed to review Jordan, Minnesota. Some of the findings will be helpful in this endeavor. This community's strengths include its size, its population, its schools, and its businesses. Jordan also has some areas for improvement, such as ethnicity and undetermined health issues. Opportunities include the median age range, healthcare services, buildings, restaurants, and art interests. Threats to this community are the lack of church offerings and no mental health clinics within the town boundaries. Healthcare coverage for the population of Jordan is 98%, and only 10.8% of the population lives below the poverty line. Economic conditions are overall good. Employment in the Jordan city grew at a rate of 3.9% from 2019 to 2020. Minnesota had 758 deaths by suicide in 2020, which puts Minnesota 33rd out of 50 states. With the suicide rate rising in the U.S., Minnesota's mental health care should be addressed. Jordan should look at ways to increase the ethnic population to address some of its gaps and add offerings of mosques, synagogues, and other options for the spiritual care of its citizens. The environmental analysis include the following: The environment of Jordan is an essential factor in determining population health. For a healthy lifestyle, the city has parks and camping, recreation and outdoor options such as hiking, biking, snowmobiling, and horseback riding. More green space and walkable paths through the neighborhoods and downtown areas could be added. Unknown is the individual behavior and how much the residents take advantage of their access to the green spaces provided. Another unknown is children or adolescent sport options, such as community sports and school sports teams. Jordan does have a baseball field with a baseball court and a skateboard park and an ice skating rink. The town has education options for children and teens. Social determinants of health, or conditions in which people are born, grow, work, live, and age, and the forces and systems that shape the needs of daily life in the town of Jordan appear to be sufficient to encourage good health and long life. Economic conditions are overall good. As we already discussed, employment in Jordan grew at a rate of 3.29%. The household income in Jordan is lower than the household income in the United States, but the largest share of households in Jordan has an income range of $75K to $100K. Jordan is located near metropolitan areas and has access to employment opportunities. With the options discussed, schooling and work opportunities, and access to health care, it can be surmised that the city of Jordan has conditions that encourage a successful life. This proposed change requires policy and financial support to establish positive systemic change. In 2019, only 45% of adults with mental illness received mental health services. The Affordable Care Act supports expansion and access to behavioral health care, which is where mental health falls. The policies regarding behavioral health in the U.S. include Opioid Workforce Act of 2019, National Health Services Corps Loan Repayment Program, Health Equity and Accountability Act of 2020, Affordable Care Act, World Health Organization Quality of Life Instrument, Medicaid Disaster Relief for the COVID-19 National Emergency State Plan Amendment, and Health Information Technology for Economic and Clinical Health Act 29. The World Health Organization has released guidelines for community health workers and has called for a renewed global commitment to reach targets to end preventable child and maternal deaths. Preventable deaths include suicide. This new clinic is an important community health goal that can be realized and will be the center of the foundation of mental health systems. The challenges with this new clinic include staffing, budgetary hurdles, and community support. Our marketing partners are here today and will be tasked with delivering information and calling for support from the community. We are focused on community buy-in. Community partners will bring knowledge, experience, values, and historical legacies to their communities. We assume that the community will embrace this clinic. We also assume that many in the community will require education and involvement to make this a success. We plan to invite and collaborate with Jordan's churches, schools, and civic leaders. The mental health clinic for the community is the change we are here to discuss. The vacant strip mall space could house this clinic. The clinic will be staffed with a nurse practitioner to provide medication management services. The clinic will employ a licensed clinical social worker who will oversee clinical social workers and social workers. This clinic will be run by the Minnesota Mental Health Clinics, which has 7 locations in Minneapolis and St. Paul area. Minnesota Mental Health Clinic is licensed by the Minnesota State Department of Human Services and is a private practice association. These certified community behavioral health clinics receive a fixed daily or monthly Medicaid payment set by the state to cover the cost of essential services. Jordan has no mental health options currently. The population will benefit from having services close to home instead of traveling to nearby towns for health care. The Jordan Clinic will decrease the burden on the Family Medical Clinic, which will refer patients with mental health problems to the new clinic. Busy community nurses with a long list of patients, often with multiple comorbidities, have limited time to assess, let alone treat mental health. This clinic will allow patients access to care and encourage relationships with clinicians. Those with mental health issues risk developing long-term physical conditions such as heart disease, stroke, diabetes, chronic pain, and Alzheimer's disease. Early mental health interventions are crucial to achieving the goals of the Affordable Care Act and other policies. Emphasis on prevention and the need to shift to a community-based model which brings care to the person in need. One of the areas of behavioral health policy in the greatest need of reform is inadequate access to care, as outlined by the National Academy of Medicine. This clinic will fill the community's need and, in doing so, will assist those suffering from mental health. These proposed changes will be the catalyst for more change and increased health. As with any change, the funding and budget are essential to its success. On the next slide is the proposed budget breakdown in full. Of note is the total expense of the startup and the first year costs. This budget includes the salaries of the staff employed to run the clinics, job statistics, data drawn from salaries.com, which may have some discrepancies due to the unforeseen salary adjustments. LCSW, CSW, SW category information is from a personal interview with Kay Hill. All furniture prices are from staples.com. On this slide is the budget template. I have printed copies for you and will discuss further the budget in a meeting with our financial partners. Those suffering from any mental disease are at the heart of this proposal, and the vision of this plan is to alleviate mental health suffering. This clinic will decrease the burden on the Family Medical Clinic. The Family Medical Clinic will refer patients with mental health problems to this new clinic. An overarching goal will be to reduce the number of suicides, aid those with mental issues, and support the community with the mental health dilemma. Assisting diagnosable mental health disorders that impair function in youth is at a high historical. Barriers to change can be reduced by having a change model. John Cotter's 8-step change model is a resource that will assist with this situation. Cotter's 8-step change model includes creating an urgency, forming a powerful guiding coalition, developing a vision and strategy, communicating the vision, removing obstacles, creating a short-term win, consolidating gains, and anchoring change in the corporate culture. This model will be used during this change process and will be the leading indicator of success. The United States Department of Health and Human Services has a 10-year national plan that addresses critical public health priorities and challenges. It is called Healthy People 2030. One of Healthy People's priorities is to increase the proportion of adults with serious mental illnesses who get treatment. They cite the evidence that medication and talk therapy can help get the care needed for severe mental illness. The goal's target is 68.8% currently. As of 2018, the percentage is only 65.5% in the Healthy People 2030. This new mental health clinic will help the nation reach this goal. Each of you here has specific duties in this undertaking, whether you are part of the MMHC, the staff of the clinic, the marketing, or other disciplines. You are the visionary leaders of this project. Each of you needs to have a vision of this clinic. You must know how much you are needed and how much your part matters. Some assumptions about opening this mental health clinic are the following. The other clinics that MMHC owns are thriving, and there's a way to assess their success. This will help the Jordan Clinic succeed, partnered with a company that has already opened other clinics. Evidence from the Healthy People 2030 shows that medication and talk therapy can help those with serious mental illnesses to get the care they need. Policy in great need of reform under the Vital Directions Initiative lists inadequate access to care, which the clinic in Jordan addresses. Barriers to this change include lack of knowledge about mental health in the community, the availability of appropriate clinical staff in the area. This team will handle these barriers, and as we work together, we will discuss other barriers that arise. As this clinic is staffed, servant leadership style of leading is preferred. Servant leadership is defined as a leader that desires to help others first and aspires to lead second. Servant leaders seek to involve others in making decisions, have ethical and caring behavior, and seek to improve the care and quality of an organization. This type of leadership typifies the style that this new mental health clinic requires. A servant leader is congruous with a mental health clinic. In summary, we have determined why each of you is critical to the success of this proposal. We have discussed the plan to open a mental health clinic in Jordan, Minnesota. We analyzed the windshield survey, the environmental analysis, the social determinants, and the policy and financial support needed. We have concluded that this is necessary for the mental health of this community. We have clarified how to evaluate this clinic's effectiveness and the expected outcomes. We have explained the timeline and what comes next. Now it's up to you. Each of you has a critical part to add to the success of this venture. Thank you. Thank you for your time, attendance, willingness to assist in this endeavor, and future assistance. Please feel free to ask questions and add any comments to this meeting. I will go around the room and give each of you some time to ask or comment on anything you'd like to.